Good afternoon, students. Norma Basalis segment 2. This is part 2. We will continue from where we had left yesterday. So, therefore, this entire portion is greater wing of sphenoid. It will articulate laterally with this portion, squamous portion of temporal bone. And this greater wing of sphenoid, anteriorly, it will articulate with, see here, anteriorly, this is the inferior orbital fissure. Inferior orbital fissure, which will open in the orbit. So this much where I am passing this probe, this is inferior orbital fissure. So therefore, anterior boundary of greater wing of sphenoid will be inferior orbital fissure. Laterally it is limited by squamous portion of temporal bone, and medially there will be this pterygoid plate, lateral pterygoid plate, medially lateral pterygoid plate, rather the root of lateral pterygoid plate. Posteriorly, it will have the presence of these foramen oval, then just posterior lateral to foramen oval, foramen spinosum. In the morning, I had drawn these two foramen, and we show that from foramen oval, mandibular nerve was passing, and from foramen spinosum, middle meningeal artery was passing in the morning. Then there will be just posterior lateral to foramen spinosum. This is the spine of sphenoid. Spine of sphenoid bone. And this is the portion where it will end. This depressed part is the portion where greater wing of sphenoid will end. So therefore it will come in articulation with the petrous portion of temporal bone. This much is the petrous portion of temporal bone. Therefore, very easily you are able to appreciate this groove. So this probe is lying in this groove. And this groove is present between anteriorly greater wing of sphenoid and posteriorly the petrous portion of temporal bone. So the name of this groove will be sulcus tubi. And sulcus tubi will show the presence of cartilaginous part of auditory tube. The cartilaginous segment of auditory tube is present here in sulcus tubi. And sulcus tubi is a narrow sulcus present in between anteriorly greater wing of sphenoid and posteriorly the petrous portion of temporal bone. So sulcus tubi. Then we come down to the mandibular fossa. Now this mandibular fossa here will have squamous portion of temporal bone, and posteriorly it is limited by tympanic plate of temporal bone. This much is the tympanic plate of temporal bone. So therefore, posteriorly, in the mandibular fossa, posteriorly, this fissure you are able to appreciate. And this fissure is known as squamo-tympanic fissure. Between squamous portion of temporal bone and tympanic part of temporal bone, this is squamo-tympanic fissure. In this squamo-tympanic fissure, a small portion of tegmen tympani part of petrous bone. Now this is the petrous bone, a small portion of tegmen tympani, which is a part of petrous bone, will be present in between the squamo-tympanic fissure. And that petrous part, in some of the skulls it is very clearly seen. In some of the skulls it will be very clearly seen. Over here on this side, on the right hand side, you are able to appreciate small piece of bone which you are able to see, very small. It's very minute. That will come in between the squamous and tympanic, in the squamo-tympanic part. And that piece of bone, because it is the portion from petrous portion, tegmen tympani part of petrous portion, it will divide the squamo-tympanic fissure into two fissures, petrosquamous, petrotympanic, petrosquamous, petrotympanic. Structures which will pass through petrotympanic fissure. So when you are asked in exam to show petrotympanic fissure, you have to show this fissure itself. So when you show this fissure, it will be either squamo-tympanic fissure or petrosquamous fissure or petrotympanic fissure. All the three fissures are the same. But explanation should be like squamo-tympanic fissure, which is divided by tegmen tympani part of the petrous portion of temporal bone. Therefore, that squamo-tympanic fissure is divided into two fissures, petrosquamous, petrotympanic. So what are the structures passing through petrotympanic fissure? Structures which will pass through petrotympanic fissure will be the chorda tympani nerve, which will come outside from middle ear cavity. It is a branch of facial nerve. And one structure which will enter inside, that is anterior tympanic artery. Anterior tympanic artery, which is a branch of maxillary artery. And one more structure will be there, which will be known as anterior ligament of malleus, which will pass outside through this petrotympanic fissure. And where will that anterior ligament of malleus be attached? It will be attached to this part, spine of sphenoid bone. As on left hand side I had shown you, similarly on the right hand side, foramen ovale, foramen spinosum, posterolateral to ovale, and posterolateral to spinosum is spine of sphenoid. So petrotympanic fissure, this entire is tympanic plate. See how beautiful this tympanic plate is. It will form the anterior-inferior boundary of external acoustic meatus. This is how it will form. Anterior-inferior boundary, tympanic plate of temporal bone. Tympanic plate of temporal bone will form anterior-inferior boundary of external acoustic meatus. And now, once again, I'll invert and I'll show it to you. So, squamotympanic fissure, then petrous portion will come in between, and petrosquamous and petrotympanic. Now we pass on to foramen lacerum. This is foramen lacerum. On this side, this is foramen lacerum. This foramen lacerum, it is present between, what are the boundaries of foramen lacerum? Anteriorly, you are able to appreciate this root of medial pterygoid plate. See here, root of medial pterygoid plate and scaphoid fossa. Yesterday I had discussed with you. Medially, this is basi-occiput. So therefore it is composed of anteriorly basilar part of sphenoid and posteriorly basilar part of occipital bone. Basilar part of sphenoid and basilar part of occipital bone. So it is called basi-occiput, which will form the medial boundary of foramen lacerum. What about the posterolateral boundary? The posterolateral boundary, the entire posterolateral boundary is composed of this segment of bone, which is called petrous portion of temporal bone. Petrous portion of temporal bone. So these are the boundaries of foramen lacerum. Now we will discuss all the segments which are passing through these different foramens.